Hello friends, welcome to Medicare Tub. Today we seeing topic about HFOV, high frequency oscillatory ventilations. So we will see in this video about what is HFOV and the indications, contraindications, what are the settings and parameters want to set in HFOV and what are the complications. So this and all we will see in this video. Come on friends, we will go inside to the video. So today content is introduction, types of HFV, what is HFOV, indications of HFOV, contraindication of HFOV, settings and parameters in HFOV, complications of HFOV. So first we will see introduction. Before going to topic of HFOV, first we want to know about what is HFV, that is high frequency ventilations. Okay, come on, we will see this one. High frequency ventilation is a type of ventilation that is utilized when conventional ventilation fails. It is a technique where the set respiratory rate greatly exceeds the normal breathing rate. In this rescue strategy, the tidal volume delivery is significantly less and can also be less than dead space ventilations. Okay, so here what they are saying is the high frequency ventilation is one type of ventilations. When the conventional ventilations fails, when the mechanical ventilations will be fails, that time this technique will be used. So that they set a respiratory rate and it will be exceed to normal breathing rate. So it will be more than normal breathing rate. Okay. So in this rescue strategy, they will provide tidal volume is significantly less and also less than dead space ventilation. So it will be less. So there's a 4 types of HFV, that and all. First one, high frequency oscillatory ventilation, HFOV, and high frequency positive pressure ventilation, HFPPV, high frequency jet ventilation, HFJV, high frequency percussive ventilation, HFPV. So this and all the 4 types of HFV. So in this first type high frequency oscillatory ventilation we will see now. So what is HFOV? So what HFOV, what we will do, what and all we can keep. So we will see this HFOV. What is HFOV? Okay. So HFOV stands for high frequency oscillatory ventilation. It is a type of mechanical ventilations used in intensive care units to support a patient with severe respiratory failure. HFOV delivers very small, rapid breath at a set of frequency. It's allowing a greater lung recruitment and oxygen while minimizing a barotrauma. So it is a one type of mechanical ventilation. So it is mostly used in intensive care units to support the patients. Mostly it will support, they will give for neonatals, for the neonatals support. Okay, its adult it will be rare. So it will support the patient with the severe respiratory failure patients, and it delivery very small and rapid breath at a set of frequency. They will set a frequency. So in that it will allowing to a greater lung recruitment and oxygenation while minimizing a barotrauma. So next we will see. Next, what are the indications of HFOV? So first one, ventilator associated lung injury and alveolar hemorrhage and large hair lake with inability to keep a lungs open, abdominal compartment syndrome and failure of conventional mechanical ventilation and refractory hypoxemia and increase in intracranial pressure, persistent pulmonary hypertension, acute respiratory distress syndrome and pulmonary intestinal emphysema, meconium aspiration, pulmonary hyperplasia, bronchopulmonary fistula. So these are all indications of HFOV. For that is pulmonary interstitial emphysema. So these are all indications for HFOV, and there are contraindications are obstructive airway disease, traumatic brain injury or intracranial hemorrhage and hemodynamic compromise. These are all the contraindications, and there is no absolute contraindications for HFOV. It's a some of it I'll give for you. Next, chest wiggle factor. Chest wiggle factor. What is chest wiggle factor? Chest wiggle factor means when we connect a patient with a high frequency oscillatory ventilation, so it will be vibrate the patients. So for infant, the up to this level it will be vibrate, and children this level, and adult this level. So this and all you will see. So for infant it will be vibrate until the umbilicals, and in children's it will be vibrate until pubic symphysis. In adult it will be vibrate until the mid thigh. This is the chest wiggle factor. It's one of the chest wiggle factor. And what are the settings in HFOV and all we'll see. So totally there are 5 settings is that. First one is bias flow. Second one mean airway pressure. Third one amplitude. Fourth one frequency. Fifth one inspiratory time. So this is one of the HFOV machine. It's a oldest machine. So here you can see a mean pressure. It's a monitor, mean pressure monitor. And here this is a amplitude. And this is inspiratory time. This is frequency. So here they will adjust the mean pressure, mean airway pressure, and this is a bias flow. In this they will adjust the oxygenation flow and all. And this and all the alarms. Okay. Now we will see what is bias flow. So it's also called as a base flow. So what it will do, it supply oxygen and it remove the exhaled air, and it generate the pressure airway pressure. And first initially they start at a 20 liter per minute, and maximum they will go up to 60 liter per minute. So what and all parameters are? For premature neonates are 10 to 15 liter per minute, and less than 1 year they will use 15 to 25 liter per minute, and 1 to 8 years patients they will use 15 to 30 liter per minute. Greater than 8 years patients they will use 25 to 40 liter per minute. So this and all the parameters of bias flow. So mean airway pressure. So mean airway pressure, it's used to optimize a lung volume, and thus it improve alveolar surface area for gas exchange. So it will be what mean airway pressure will do means it will be optimize a lung volume, and it will improve the alveolar surface. Why means for a gas exchange it will be improved. So in neonates how much mean airway pressure will keep means 8 to 10 cm H2O, and in infants 15 to 20 cm H2O we will keep. Next, third one, amplitude. So amplitude is, first this is a distance the diaphragm moves. So it will be movement of a diaphragm, and it will be set the P swing around mean airway pressure. And if it is too low, if the amplitude is too low, the patient will went to under ventilation. If amplitude will be too high, it will be cause a villi ventilator induced lung injury. So it will be determines a tidal volume. This amplitude will be determine the tidal volume. So what and all parameters means, it will fully depend upon a weight of the patients. Okay, if the weight is less than 2 to 0 kg means we will set 2.5. If the weight is 2.1 to 2.5 kg, we will set 3.0. If the weight is 2.6 to 4.0 kg, we will set 4.0. So if the weight is 4.6 to 5.0 kg, we will set 5.0. If the weight is 5.1 to 10 kg, we will set 6.0. And if the weight is greater than 20 kg, it's a last, we will keep 7.0. So next fourth one we will see frequency. So the frequency will be measured in hertz, and here 1 hertz equal to 1 cycle or 1 cycle per second, it's equal to 60 breaths per minute. So 1 hertz equal to 60 breaths per minute. So if it is increase in amplitude, there will be decrease in frequency. If decrease in age or weight, it will increase the frequency. If the decrease of compliance, it will increase the frequency. So once the amplitude is increased, the frequency will be decreased. Or there is a decrease of age or weight, it will decrease the frequency. Or it decrease of compliance, it will increase the frequency. So what and all parameters means? For preterm neonates, we will set 15 Hz, and term neonates we will set 12 Hz, and infants or child we will set 10 Hz, and older child will keep 8 Hz. Next, fifth one is inspiratory time. So it will be similar to a conventional ventilation. So in conventional ventilation, what we will say, IE ratio is 1:2. Same ratio 1:2 only we will set here. And the inspiratory time is 33% want to be. And it increasing inspiratory time will lead to a hair trapping will be happen. So what are the complications in HFOV we will see now. First one, irritation will happen, and hypotension, and pneumothorax, and if endotracheal tube obstruction due to secretion, due to large secretion, ET tube will be blocked, and intracarinal hemorrhage, and bronchopulmonary dysplasia, and necrotizing trachea bronchitis. These are the complications of HFOV. Thank you friends. Subscribe our channel and like, share and comment. Until June month, a video will be come late. So don't think bad. You doing one subscribe will be motivation for me. And I think you like this video. Okay friends, thank you. Have a great day.